Hello, everyone. Thank you for joining us. We are going to get started in just another minute or two, but we're just going to wait for a few more people to join us. So we'll be starting very shortly. All right, hello, everyone. Welcome to the first of two residential treatment listening sessions. First, let me start off by saying thank you for joining us. I know that it's not easy to carve time out of your day, and so I just want to say that we appreciate you taking the time to share your experiences with us. Just a few housekeeping things before we get started. I just want to take a minute to orient everyone to the WebEx system. If you have not done so already, please call into the webinar using the audio conference information found in the Event tab, which is above the slide deck. This will allow you to participate in the discussion portion of the webinar. Once on the call, you will be unmuted. When you're not speaking, we just ask that you please mute your telephone to avoid any feedback or background noise. If you come across any technical issues during any point in the webinar, please chat to the host, Ms. Brianna, and she should be able to assist you. You can find the chat box on the right side of your screen, and if it doesn't appear, click the dialog bubble on top of the right toolbar and it should pop up. Okay? All right. So just to better define what will be covered during the call, let's take a few minutes to review the agenda. We will start with brief introduction. We will move on to the purpose of today's call, discuss some facts for consideration, and review best practices, and then we're going to open up the floor for some discussion. I'd like to take a moment to introduce myself. My name is Yvette Kelly, and I'm with the Community Technical Assistance Center of New York, which provides training, consultation, and support for an array of children's mental health programs. And in the near future, we will be providing specialized offerings for RTF. I will be the one facilitating us through some guided discussion today. We will also be joined by some of my colleagues as well on the line, Carolina Sale, Lydia Franco, Ann Colpinger, and Jerry Burton, along with some representatives from OMH who will just serve as active listeners during our webinar today. All right, so just so we can get a sense of who is on the line, we're going to ask that you respond to this poll question and let us know what's your role in the agency that you're currently with. So if you could just take a few minutes and answer the poll question, we'd appreciate it. This will just help us understand who's on the line. We'll take a few minutes. And if you're just joining us, we're just asking that you please complete the poll question just to let us know who's with us today. All right. Great. So we have, looks like we have some directors, some clinicians, and administrative support, and other RTF staff. Well, thank you very much for joining us. So I thought I would just start the conversation by providing some context as to the reason and the purpose of our call today. As I mentioned earlier, CTAC will begin providing specialized offerings for RTF, and in order to ensure that the offerings are in line with the needs of providers, we'd like to refine our understanding of the following, which is, what are some of the engagement practices that you are currently utilizing with families? How about some of those clinical practices? What does your organizational structure look like? We really want to hear from you guys around some of the reality-based challenges And what are some of the additional training and resource needs? Again, this is all to help us kind of figure out what would be the best supports for RTS providers. Let's take a minute to discuss the role of CTAC. I think in this context, as we provide technical assistance, it is our role to support residential treatment facilities in their efforts to adopt best practice approaches. And we will be talking about what are some of those best practices approaches in the near future moving forward. So again, it is our role, and that's kind of what we're hoping to get out of this listening session, is to really understand how we can support providers in adopting these practices and improving how they're working with children and families. First, I'd like to start by offering some facts for consideration. All right, so nationally, as well as statewide, residential services are being challenged to employ practice models to achieve greater quality, efficiency, efficacy, and effectiveness. What we hear and what we know is that residential services are costly. We also know that the impending transition to managed care creates vulnerabilities for RTS providers. We're going to talk about that. We know that residential is an important piece in the continuum of care when leveraged appropriately. And we know that in the near future, residential providers will be required to transform in order to remain viable in the long term. So we have to recognize as providers that the rules have changed. And what exactly does that mean? It will mean that we will, as a residential treatment facility, be forced to look at our practices, be forced to refine some of them, and really fundamentally change how we work with families. And so this conversation today is a little bit about how we prepare ourselves to do so. Again, what are some of the needs and supports that it's going to require for us to be in a position in which we're able to work more effectively with children and families. So here's just a little slide of some perceptions of change. Everyone will have different perceptions and emotions regarding the impending change. Some providers will choose to change before they have to, and others will be forced to change. But what is clear is that change will be a requirement for sustainability, meaning that we are going to, as providers, have to meet the bar, especially as we move forward. We're going to need to figure out how do we improve our practices, again, to make sure that we are providing quality services to children and families. And what are some of those service trends that we see on the horizon? We know that we're going to get less money from local, state, and federal governments. We know that service purchasers, managed care organizations, and regulators increasingly want to buy results and not services. Right? There's going to be an emerging emphasis on healing and wellness as the desired end result. So again, we're going to be required to do more than just provide the services. They're really going to be looking at those results. There's a push to redesign existing services to ensure more durable results that can be sustained for 6 to 12 months. And this is really key. Engagement is going to be seen as a means and family stability as the goal. So really, providers are going to really have to work hard at making sure that they are refining engagement practices, that they are working collaboratively with families, because that's going to be essential as we move forward. The emphasis is going to be on meeting safety and security needs as well as clinical needs. And care coordination and continuity of care is going to be seen as essential services, right? How are we coordinating the care for individuals, especially individuals who have high needs, right? That's going to be key. There's going to be an emphasis placed on community-based and not campus-based service delivery. All right, and so that we have, as a residential provider, we have to think about how is that going to challenge us. Out-of-home care primarily is going to be utilized for crisis stabilization. and that there's some expectations that we as providers connect families and children to existing community resources, that we leverage those for their benefit, that we focus on helping build their natural support networks, right, for them to be able to maintain in the community. The emphasis is going to be on shorter durations of service whenever possible. All right, so we're really going to have to think about our length of stays in residential facilities, and what does that mean in terms of a target, in terms of where we're trying to get to. And fast moves toward permanency for children not returning home. So how are we going to assist those children who don't have, when they come to us, permanent options for when they leave the residential treatment facilities? And how can we secure the discharge options for them? So that's going to be something that we're going to have to consider as well. And so what does that mean as a workforce? What are some of those things that we are going to need to do? Well, we're going to need to be able to support children and families in their homes and communities, right? We're going to be able to need to be able to utilize evidence-based modalities that ensures durable and lasting results. Again, we're going to need to truly engage families by forming relationships with families that are collaborative in nature and that built upon a foundation of mutual respect. Okay. We are going to need to create a trauma-sensitive environment to make sure that we as providers, no matter how well-intentioned, are not re-traumatizing or exacerbating symptoms of trauma. Right? So we're going to have to look at our own processes in terms of how we're handling high-risk and high-needs and vulnerable populations, and ensure that how we're working with children and families is not going to be re-traumatizing. And I think this is important to point out, that we are going to need to adequately prepare our staff for the challenges of working with highly vulnerable populations, recognizing the emotional toll that this can have on individuals. Okay. We need to ensure that quality supervision is provided to all staff to protect against burnout, as well as inferior service provision. And I can't stress that enough about how important that is going to be for agencies to adopt an infrastructure that really does provide quality supervision for the workforce. So before I move any further, I want to stop here to invite some conversation about what was just presented and what you as providers think are the critical elements to address now in order to be prepared for upcoming changes. So as you think about the landscape, you think about the service trends, what do you think are some of the critical elements that we need to be paying attention to in order to be prepared for upcoming changes? And so you can either chat that in, but if you could unmute yourself and speak, that would be great. We'd love to hear from you. Anyone? What are some of the critical elements that we need to be paying attention to? Give everyone a few more minutes. I just want to reiterate that we are hoping to really, again, hear from providers. This is an opportunity that we hope that you would talk about some of your experiences.
I have a comment. I think that everything that you've identified, that I think we at the RTAC are preparing for that. I think one of the other things is also doing collaborative efforts with the community in being able to build a lot of the supports for the kids in the community.
Yes. I'm sorry, can you just say, when you speak, can you just say your name so we know who's talking?
Jean Sidali, out of the Western.
All right, Jean, so that's great. So building some of those community supports, so being able to link children and families back to the community once they're ready for discharge. Great. I see that Fran putting more formal training on multi-systemic family therapy would be helpful. We hear that a lot, that there's not a lot of training around family therapy, and that is really going to be essential moving forward, especially as we talk about engaging families and how do you really work with families to get them in a position where, they can be successful out in the community and rely less on services and more on their natural support. How about others? So we have Marie, she says efficiency and treatment provision, how to get the best outcomes with available resources and skills in shorter periods of time. Yeah, exactly. That's, one of the things that we've talked about is just that is going to be so critical, especially as we move into managed care. Managed care is just a piece of this puzzle. I think what we recognize is that despite the fact that managed care is here, that even if they were not here, we would still need to be taking a look at residential treatment facilities and trying to figure out how to provide the best services possible. But right, efficiency in treatment, using those evidence-based practices, for instance, outcome measures, just being able to measure our program success and what does that look like and how are we tracking, that's going to be essential as we move forward. And also, how do we utilize that information and data to inform our practice, right? So that's, we're going to need to be able to do that, to use that to refine how we're working with families. All right. Any others before we move on? Okay, so evidence suggests that these practices work best with families. Some we've already mentioned, but we're just going to take a little bit of a deeper dive into them. We have trauma-informed care. We have family-driven care, crisis stabilization and reintegration, and home and community-based services. So let's just take a few minutes and talk about creating a trauma-sensitive environment and what that means, and then want to kind of, again, throw the question out in terms of what are some of the things that you guys as providers are doing around trauma-informed care. So we know that professionals must understand the impact of trauma on child development and learn how to effectively minimize its effects without causing additional trauma. And that they have to be, these are things that have to be in their policies, right? It needs to support building trauma-informed systems and assessing and treating trauma, and as well as addressing secondary trauma in providers. Again, I mentioned that we are in a place where we need to ensure that our staff are adequately trained and prepared and being able to work with the neediest population. But we also need to consider how that impacts individuals and what are some of self-care strategies that we can do and support as agencies to ensure that our staff are in the best place possible when they're working with our children and families. And so there's another comment that came in that says closer collaboration with state, city, and local hospitals to divert youth who do not need a locked hospital setting, but rather a safe and structured setting. Exactly, those are all of the things that we're talking about. So how do we, divert youth? How do we provide the best care possible in the least restrictive setting for kids and families? All right. So take a moment, if you can, and if you could just chat in, like, what practices does your agency currently employ that supports the learning and implementation of trauma-informed practices? What are some of the things that you do at your agency to support this? I'll give people a few minutes. You can either chat in or you can speak, unmute yourself and speak. Okay. So Amir says adoption of the sanctuary model for residential programs and regular training around topics of self-care, parallel process, and traumatic reenactment. Great. So those are some things that your agency is doing in order to address this. How about others? What other types of support, what other types of things are you doing that supports the learning and implementation of trauma-informed practices? Any others that like to talk about how their agency supports the learning and implementation of trauma-informed practices? So Fran says all of their clinical staff take trauma-focused CBT online. Great. And so I'd love to hear, Fran, just a little bit about how you sustain that learning with the staff. What's the process for sustaining that learning? Okay. We have Michelle, who also says we share information with families regarding, I did not get all of it, so I apologize. Michelle, if you could just chat your comment back in or either unmute yourself. All right, so there's Marie says that there's national subject matter experts that provide training to all staff. That's great. So there's a lot of you doing trauma-focused CBT training for all clinicians. Some of you use the UCLA trauma assessment for those with trauma history. Okay, so Michelle said they share information with families regarding their ACEs scores, weekly supervision of all clinical staff. Can we take a moment and just to talk about how you support the learning of like trauma-informed practices? I hear a lot of you using scales, and I see that there's some web-based training. But what do you do as an agency that supports their learning? How do you ensure that those things that they've learned that they put into practice? Can we just have a few comment on that? So again, Fran says supervision of clinical staff. How about others? All right. So then we'll move on to this question, which is, what supports do you feel are needed to become more trauma-informed? What supports do you feel are needed to become more trauma-informed? All right. So kids having coping skill objectives. How about others? What do you feel is needed in order for you to become more trauma-informed, you and your staff? What supports, what resources, what training? Anyone out there willing to share? I think what we hear often when we're out working with providers is that it's very difficult to allot the time needed to ensure that staff are adequately trained. And so sometimes it's more not necessarily about, we don't have the training dollars per se, but, we don't have time to train our staff, or, we're dealing with crises and it's difficult for us to kind of pull ourselves away. So what are some of those other things that get in the way of adopting some of the best practices? Okay. And so Fran says, and I just want to talk about this because this happens, is Fran said that they had a grant to provide trauma training for 1 year, but it was not renewed. So being able to sustain some of those evidence-based practices we hear are often a challenge, especially if they're costly. So being able to sustain them. providers have noted that that's been a challenge. Okay. And some of the other things is, what supports do you feel are needed in order to translate the learning and the learning that you do at the RTF facility home? What other supports are needed from that perspective? All right, we have a few comments coming in. So it seems like you need trauma awareness and support for everyone, not just the youth in the program. Our staff may not do their best work with youth if they are experiencing their own trauma, and that's a great point, Marie. I think that was kind of what I was speaking to when I said that we need to be able to ensure that our staff are well positioned to care for kids, because you're right. A lot of times we have staff, people who experience their own trauma, and then we're expecting them to come in without doing any assessment of that and working with children who have very significant trauma. And I think what we don't really do a good job of as providers is really kind of reflecting with that staff individual about how their own, how their own issues may be triggered or how they may be impacted, and really assist them and trying to mitigate that so that we ensure that they're in the best shape to do the best work possible. Yeah. So there's a couple other comments. Just back to my question around creating how do you ensure that the learning basically is generalized to the community. So ongoing support after discharge. Creating a safety, Michelle says, creating a safety plan that's accessible and easy to use in the home environment for parents and guardians, and assisting the family in practicing these skills. Yeah. Those are all good things, and we'll talk a little bit more about that. Any other comments regarding trauma-informed care and what your agency may do well? And what they may need to, how your agency may do well, or some of the good practices and other supports that may be needed. All right. So another core concept is family-driven care. And when we talk about family-driven care, we're talking about families having an active and meaningful role in treatment, that through their interactions and feedback from families, that your policies are reviewed and revised accordingly to ensure that families are valued and have choice, and so that families are a part of the process and not really just sitting on the sidelines. And so this is going to be so essential as we move forward. And, as some of you mentioned, I think understanding that some family therapy work needs to happen is going to be important, in making sure we are, as providers, are in a position to provide that to children and families is going to be key. So again, when we talk about family-driven care, we're talking about giving families choice, but they need to be part of the process from day one. They need to be clear about what services are available and how they can access them. And so this is really going to be, I think, for some a challenge. For some providers, they've begun to do a lot of this, but for some providers, it's going to be a bit of a challenge. So tell me a little bit about how what practices in your agency really speak to supporting family engagement and treatment. So what are some of those practices that your agency employs that really supports families, really talks and speaks to family engagement and treatment? Give you a few minutes to chat. And I just want to reiterate that really this, the purpose of this webinar is really to help us inform our technical assistants and how we can best support providers. So we're really asking that that, you know, folks talk with us about some of their challenges, so we could just ensure that we, you know, develop a plan that's relevant, meaningful, and practical. So again, what are some of the practices that your agency currently utilizes that support family engagement and treatment? Right. So Marie says you assist families to understand some of the techniques and practice the skills. Okay, mothers. Any others want to talk about what their agency does that supports family engagement and treatment? All right, so Fran says they have a full-time family advocate who connects families to resource centers in their community. That's great. And I think that is another, that's another piece of being family-driven, is really utilizing some of those advocates for families to really help, I guess, inform kind of, you know, kind of translate between the provider and family. So that's really key. So we have people using family advocates. How about others? Do other residential treatment facilities have family advocates that they utilize? Okay. So we have a couple of comments that came in. So Michelle says a challenge that they experience is identifying youth trauma, difficulty identifying their own trauma experience. And I apologize if I got this in a little late. But also find the value in trauma-informed care and often view trauma as normal experiences that occur in life and are looking to the residential providers to create a Band-Aid solution and struggle to see the benefit of addressing trauma. So really challenged with engaging families and really getting them on board with what needs to happen and to improve their situation. Right. There's a couple of you who also utilize family advocates to connect families to resources in their communities. Transportation services for family members, that's great, residing outside of the region, connecting with family at pre-placement process, of family therapy early on in the admission process. This is a great one, meetings in the family home rather than on campus. And so can we hear from Marie, can you just unmute yourself, and can we hear a little bit about how it is that you are able to go out into the community and work with families? Would you be willing to talk with us a little bit about that?
Okay. The general practice, I'm from Hillside Family of Agencies. I run the Crestwood RTF. And basically what we do is we look to, as often as possible, engage families and their resources in their homes, so that or in the community, so that they're not traveling sometimes significant distances, and two, so that the child can be there, the family can be there, all of their particular resources can be there, and we can engage the community as well as available.
Okay. And do you find that that really is helpful in engaging families into the treatment and kind of what needs to happen? Do you find that to be a benefit to treatment?
Sure, because I think that there's a distinct level of comfort that they experience in their own home that they don't experience when they come into a conference room and look around and there's 22 professionals around the table. And so they're already feeling awkward and uncomfortable about being there and alone. So we really try to make sure that there are supports and resources for them as well in an environment that they feel more comfortable.
Excellent, excellent. And so your agency obviously supports her being able to go outside of the facility to provide these types of home and community support.
Correct.
That's excellent. All right, we have Gretchen who says they do family nights, they do bingo, picnic, holiday parties. And so, Gretchen, do you do those at the facility or do you go out in the community? If you could just unmute yourself and respond. I'd appreciate it. Some others are using some of the Building Bridges work for guidance and working with families for the family support work. And I just want to say that, yes, the Building Bridges is definitely a great tool to really look at to help you become more family-driven. And so we're aware of that as well. Some of you have family advocates that you're utilizing that. Jim says he utilizes a parent partnership group that meets monthly for family networking and special guest speakers, talking to families on things that affect their children. And Jim, can you tell me if you do that at the facility or do you do that in the community? For those of you who, when distance is an issue, you've used Skype. That's pretty creative to help children stay connected to parents, siblings, and pets between visits. You guys are doing a lot of stuff here. What about, what supports do you think are needed? We'll move on to the next slide. What supports do you think are needed in order for your agency to become more family-driven, to be able to go out and connect with families in the community more? What types of supports do you think are needed for that? We have some, there are some RTF transition coordinators that I know go out in the community, right, to really connect families to supports in the community. Do we have any RTF transition coordinators on the line that would be willing to talk about what it is that they do? Okay. All right. Some of us are not on the phone line, so I do apologize. And so Jim cannot respond to my question verbally, and that's okay. So he'll say that need more family advocates. He has one family advocate between 50 RTF beds and 16 children's community residence beds, so that's a lot. So when we're talking about what supports you feel are needed, definitely more family advocates. Increased transportation resources. All social workers should have dual functions of social worker and transition coordinators. So it looks like transportation tends to be an issue sometimes for families. Flexibility in staffing, smaller geographic area to serve, and of course pay increases, which is always helpful. So it seems like Michelle, can you talk a little bit about your flexibility and staffing, just so we understand exactly what you mean by that? Are you able to talk on the phone, or if not, if you could just chat it in? What type of flexibility in staffing are you referring to? And also just smaller geographic area to serve. So if you're serving children who reside, anywhere from probably 30 to 60 miles out, it seems like it would be a bit more challenging to be able to get out and connect them into the community. So I believe that's what Michelle is referencing. Are there any of the providers on the line who actually do have children and families that are anywhere from 30 to 60 miles out or more and are able to do a good job connecting them back to the community? And if you do a good job at that, do you mind chatting with us a little bit about how you're able to do that? Okay. Give them a few minutes to respond and move on. All right, so the residents have to have staff available for coverage at the residence, but need to be available to go into the homes more frequently. Okay, so that's Michelle in her response to the staffing concern that there are some regulatory staffing requirements which we're aware of, and that you actually need to have additional staff in order to be able to pull staff from the residents to be able to go out to the community. It seems like some of you are in rather large regions, and families can be up to 3 hours away, which can be very problematic. But again, are there any agencies on the line who have been creative and really trying to find a solution to working with children and families in their communities that are actually some distance away from the RTF? And if so, we'd love to hear about how you're able to do that. Okay, we have, Michelle says we're currently getting into the home of the residential staff bi-weekly to monthly, and we would like to get out to the homes at least one time weekly. Okay. So we are going to move on to the next practice of crisis stabilization and reintegration. And so these are services that are direct mental health care to non-hospitalized individuals experiencing acute crisis. And the whole goal of this service is really to avert hospitalization or rehospitalization. And if you remember earlier on in the presentation, one of the service trends were that out-of-home placements were going to be, that they're trending to use them more for crisis stabilization. So sometimes more on a short-term basis rather than a long-term basis. That's kind of the service trend. And so I just want to hear a little bit about kind of how you are currently dealing with crisis and managing crisis, and what are some of the practices that you're doing to stabilize children and families. So can we talk a little bit about crisis stabilization, and what practices does your agency currently utilize to stabilize youth who are experiencing a crisis? And I'd like to know if this is an area that you feel like we do this really well, or is this an area that you feel like we need to have more training and on how to do this well? So if you could just chat in. What are some of the practices that the agency currently utilizes to stabilize youth who are experiencing a crisis? And what are your perceptions about how effective these practices are? We'll give folks a few minutes to chat in. So how is your agency supporting children and families in crisis? Anyone willing to chat in regarding crisis services? What are some of the challenges that you experience? So Jim says they do one-to-one calling home to a family member, speaking to a particular staff who has a strong relationship, and that's how they manage crisis. Okay. And would you, we have some more, I'm sorry. Then we have, there's some mobile crisis teams. It says that the residential facility would partner with RSS and utilize safety planning, mobile crisis assessment teams, training on DBT and crisis intervention. But despite all that, they struggle with getting the information to families and assisting them in using these skills at home. And that's a challenge, being able to have families generalize what they learn in the facility to at home. It's a challenge. How about others? Family advocates work closely with families identified to be at high risk. Okay. Any others? What practices are your agency currently utilize to stabilize youth who are experiencing a crisis? And do they tend to be effective? How effective are the practices that you're noting? Does utilizing these strategies, do they lead to decreased restraint? That'd be like a marker in terms of trying to figure out, are they effective? And if not, what do you think are some of the needs around crisis management? What are some of the challenges? Some of you say it depends on the severity of the crisis as to whether or not it's effective. Any others that would like to comment on what their agency does to stabilize youth? And then we'll just ask that same question, what supports do you need to learn to manage crisis situations more effectively? What are some of the supports that you need? Mary says the direct influences in the community at large. Mary, can you talk a little bit more about that, what you mean by that comment, if you don't mind? Marie said practices are individualized and fluid, that what works today with one child may never work with another child and may not work tomorrow with the same child. Staff have to have lots of skills and tools. Yeah, I think that's, again, what we've heard is that, and I think you speak to a point, Maria, that we know that these plans need to be individualized, right? That we can't just assume that what works for one works for all, that we really have to be talking with the family, talking with other people who are important to the family and other providers around how to best wrap services around this individual, and what does that mean in terms of how we help them manage crises. But I think you're right in that staff has to have lots of skills. Those are things that we need to teach in order to be able to do that effectively. Any others? Any others want to comment on support that they need to learn to manage crisis situations more effectively? So Fran says they have a trainer who is valuable in training and reinforcing skills to work with kids. Okay. So again, I want to go back to this question in terms of how does your agency help to support staff around learning these best practices and then implementing them on a daily basis? What are some of the systems that your agencies have set up in order to ensure that the learning continues? Let me take a few minutes to just comment on that. You know, I see that a lot. There's a lot of training going on, and just want to know how that is sustained over time. And as you're thinking about that, and then thinking about, again, the service trends and what's kind of on the horizon in terms of providing care to children and families, what do you think are some of those critical elements that are needed in order for RTX to be in a good position to provide quality care? What are some of those things? Right? So what are some of the needs based on the service trends? What are some of the supports and resources that you feel are needed? Again, you can either unmute your phone or feel free to chat it. All right. Some of you are using TCI. Again, how are you sustaining that learning over time? Right. Anyone be willing to unmute themselves and talk about how they help their staff or how the staff is supported in implementing the learning that's going on? All right. So Amir says there's crisis prevention specialist role constantly based within the milieu to support direct care staff in managing and preventing crisis, along with providing training and mentoring in the development needs of children, to support direct care staff in managing, preventing crises, and there's a need for more available discharge resources. Okay. And so if we think about the next one we talked a little bit about this in terms of providing services in both home and children's communities. And again, what resources are needed in order for you to do that. And you guys mentioned kind of you need more staffing, there's that staffing requirement. But is there anything else that you could think of that would help you be able to support children's reintegration back into their home and communities? Anything else that you think is essential to providing for families that will help shorten the length of stay for children? Any feedback regarding that? Or, so I hear some saying that sometimes it's discharge becomes an issue because the child may be ready for discharge, but for instance, there's not a school program for that particular individual, and so that's a challenge. Any other challenges? And we did talk a little bit about this, about current practices that support your ability to work with families in their homes. Again, with some transportation, some staffing needs, some of that. So for instance, for use of cognitive limitations as well as emotional disturbances, there are limited discharge locations and resources. Complicated medication regimes impact securing community aftercare. Okay, so if you have a child who has a complicated medication regimen, being able to find the services necessary to sustain that is a challenge. Any other challenges? Any other challenges? Any other practices that you guys do that will support the ability to work with families in their homes? Okay. And so right now I just want to open it up to kind of ask you guys, are there any ideas that you have in terms of what might be helpful for you as providers to be preparing for some of the changes that are impending? Anything that we haven't thought to ask as far as you know, information regarding what would be helpful to you. So I just want to open it up to see if anyone has any thoughts or ideas, anything that we missed that people want to say, you probably should have asked this question. We just want to open that up, and again, feel free to chat in. So again, I just want to reiterate that we really are looking for your input in terms of what you might find helpful in terms of trainings and support as we move forward. So Jim, it says also they can use a greater expansion of parent resources centers in all communities. Okay. And what about RTF specifically? Are there practices that you think would be helpful to adopt in order to improve practice overall? Any of those things? All right. And lastly, are there any questions? Are there any questions? Any questions that you have, either that you had about the presentation, or any questions around that? All right. If not, then I just want to thank you all for participating. And so let me just explain this. There is a question saying, what next? So let me just explain what's going to happen. So again, as I mentioned earlier, we are looking for your feedback to help us really refine offerings that are specific to supporting and helping the residential treatment facilities. This is the first of 2 listening sessions that are offered. This was the first one. The second one is June 19th at 10 a.m. And so I just want to say we want to invite you to speak to folks and invite them to join so that we can hear their feedback. We are really interested in hearing from providers around their needs, around their challenges, and what they think they need in order to be successful. So if you have someone else at your facility who wasn't able to join us today and you would like to invite them, again, to the other one, all staff are invited to attend these listening sessions. And so we're really looking for that feedback and input. But once we obtain kind of all of that feedback from you guys, we are going to look it over to really decide how we can best support the learning moving forward. And so if you think of something after this webinar, please feel free to send it to me directly. And here's my contact information. So please feel free to send me an email and I will respond. But again, we're really just looking for this feedback to help us refine some of the trainings that are offered. And we know that, you know, it's a changing world. And so we really want to assist providers in really situating themselves to be able to provide the best services possible. So again, thank you for participating with us today. If you have any questions again after the webinar, please feel free to send me an email. And otherwise, I will talk to everyone later, and I hope you enjoy your day.